So welcome and thank you for joining us today for the meeting of the New York City Health and Hospitals Capital Committee. Today's meeting is officially called to order. It's not for the record that Sally Hernandez Piñero is participating virtually in a listening capacity. I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on September 11th, 2023. All in favor, please say yes.
Yes.
Opposed, say no. And that was Dr. Katz, Frida Juan, and Jose Pagan. So next, we will hear the Vice President's report. Mr. Saiz.
Good morning, everyone. It has been an eventful month for our office. As we all know, there was devastating flooding throughout New York City last month, and it has impacted several of our facilities. Woodhall Hospital was severely affected, with the flooding causing widespread electrical issues that required emergency responses from our hospital and our facility staff. Emergency generators were put into use, and there was an active planning of a full evacuation. Our teams worked around the clock to get systems back up and running, including boilers, chillers, air handlers, and other repairs. I am very proud of the exhaustive effort we put into the work, including collaborative efforts with external contractors and sister hospitals. While this was a terrible situation for Woodhall, the entire team and the organization came together to provide the best outcomes for our patients with the least possible disruptions. We are moving forward with the replacement of the boilers at Harlem, looking forward to a 2-year endeavor via design-build method to overhaul and upgrade our boiler plant, which will utilize new technologies and will provide consistent, reliable, and redundant services to our facility while reducing the carbon footprint. We have installed the temporary boilers and are ensuring that there are soundproof barriers in place, and we are currently awaiting inspection. Last month, we celebrated Facilities Week, where we acknowledged our incredible teams for the difficult and essential work that they do. We celebrated with breakfasts and lunches and an insider article. Our team was thankful for the acknowledgement of the important and hard work each and every member contributes to our organization. For this Capital Committee month, for Capital Committee this month, we have 2 items with 6 resolutions. We are bringing a new food service vendor to Harlem, Kings, and Queens Hospital, and are looking for increased funding for our high-profile OTXHU project. And with that, I'll take any questions.
Manny, could you talk a little bit about the situation with the ORs at Harlem? I understand they're in the process of renovation, but I don't have a great sense of what the issue is.
So, are they on the docket here? I'll have to follow up with you, Dr. Katz, if you don't mind.
Okay.
I don't have enough detail.
That's fair. Okay.
I don't want to speculate.
Okay. Thank you. Okay, let's get started with the first three resolutions. Manny, do you want to read them?
Should I read them consecutively? Or?
I can,
Oh, I'm sorry.
I can do it.
The first three, yeah.
Yeah. So we're here to authorize three license agreements for food services at Queens, Harlem, and Kings. The resolutions are authorizing New York City Health and Hospitals to sign 5-year license agreements with Every Table for its use and occupancy of space in each of 3 facilities for retail food operations, with each agreement to be terminable by both parties on 30 days without cause as follows. Approximately 500 square feet at New York City Health and Hospitals Queens at an initial rate of $50 a square foot or $25,000 per year to increase 2% per year for a total occupancy fee over the term of $130,101. Approximately 468 square feet at Harlem Hospital at an initial rate of $50 a square foot or $23,400 per year to increase by 2% per year for a total occupancy fee over the term of $121,775. And approximately 360 square feet, New York City Health and Hospitals Kings County at an initial rate of $45 per square foot or $16,200 per year to increase by 2% per year for a total occupancy fee over the term of $84,305. Next slide, please. I think the Capital Committee is familiar with the background of food vendors at H&H facilities. We return to the theme of food services, of healthy, affordable food to prioritize options for our patients and staff because food options are limited in the proximity of many of the facilities. They're not necessarily healthy and they're not necessarily affordable. Currently, Queens and Kings have vendors, but they're not open 24/7 and providing sufficient services. And Harlem has no vendor. And as you know, we don't have a system-wide approach to food, and many of the food vendors closed during COVID. Next slide, please. As we said in May and September, when we brought Every Table for Jacoby Met and South Brooklyn, and in September we brought Tasty Picks for Met. This is the selection process. Each facility independently selects their vendor to suit their needs. They look for healthy options, culturally sensitive food operations that are 24/7. And in this case, the facilities have selected Every Table again. Next slide, please. Before I talk about Every Table, just to recapture what is going on facility-wide at Bellevue, Elmhurst, Jacoby, Met, and South Brooklyn, and NCB, Lincoln, and Woodhull. You can see there are 6 different vendors serving our facilities. Next slide. As I said earlier, the 3 facilities have selected Every Table again. The photos that we have presenting here are actually an update from what's going on at Jacoby Hospital. Mercedes Redwood is here, my colleague, to speak about the success at Jacoby and Met of Every Table and why other facilities have continued to select them. Mercedes?
Sure, yes. Good morning, everyone. I have to underscore that last year, March, when we implemented plant-based by default to our patient, lots of our employees asked, well, what about us? You know, we want to see more healthy and nutritious meal, and Every Table fits that portfolio. Today, Jacoby did their soft opening and then actually went live on the 16th of November. And they actually, their sales are now up to over 4,000 meals, 4,800 transactions. And we actually estimated about 5,000 employees and visitors throughout the campus. So that's a great success. In addition to that, one of the key things is, you know, employees really want to be able to get to the space, get out. Throughput is wonderful. The meals are tasty, they're culturally sensitive, and affordable is the biggest thing. The key is also consistency. You know, the meals are standardized recipes and they're consistently tasting and nutritious and scratch cooking out of their commissary in Brooklyn. So that's the key there. As a registered dietitian, you know, I do endorse it and really encourage everyone at this room, if you haven't got a chance to go to Jacoby, please do so. Metropolitan, I was so delighted to see that. Metropolitan opened up last month, early part of last month, and I am so tickled that in a small space, they were able to present a professional space, fresh looking food. Also, they do pressed juices there too. So you're able to get, you know, juices in a bottle that is without additives. So that's also important. And they're doing over 1,800 transactions there, which I think is awesome.
Wonderful. Thank you, Mercedes.
Yeah.
I like the feedback. And
Maybe we should
everything
tell them
here is
cable.
the menu, same menu we spoke to the multiple times we brought Every Table. Next slide, please. These are the terms for the Queens transaction, 500 square feet, as I said earlier, to $50 a square foot. All price increases must be approved by the facility, except if it's a CPI increase. So next slide, please. Harlem, it's 468 square feet, and the rent is $50 a square foot, same terms. And then Kings County, next slide, please. Thank you. Again, 360 square feet on the first floor, $45 a square foot. And that's the presentation. Let us know if you have questions.
I'm so excited. I want to try the food right now. Thank you. Just a question. I saw that it says Every Table is a Delaware Public Benefit Corporation. Does that mean it's a governmental entity like
No,
we are?
not for
or-
them.
No.
You know, Delaware has a kind of a weird extra kind of corporate creature.
Oh, okay.
So it's not a government
Okay.
entity. It's a private entity. It's not a not-for-profit entity. It's a for-profit entity with certain social benefits as part of its purposes.
Interesting. Okay. So does it have like sort of a different tax status or something?
No.
Anyway, that was interesting to me. And then I think maybe there's a bit of a typo just for the next, the board meeting when you do the presentation. If you go back to the Queens slide. Well, Queens and Harlem both say it's $50 a square foot. I didn't do the math to figure out which one was right, but they have, I think maybe Harlem is right and Queens is different. I'm not sure.
It's different square footage, but we'll take a second look.
Yeah, no, actually, because the square footage is bigger in Queens, but the rent is lower. So I guess I was confused. Actually, wait a minute. I think the also, there's two things. The table on Queens, page 8, doesn't match the text. So 16,200 for Queens, but the table.
Yes, all right, I see the error. I apologize. Well, that's just a typo on that second bullet. Sorry about that. We'll fix that.
Well, the 16.2 is for Kings.
I see, I think
It's
there's.
Leora's fault. We'll have it.
Well, I guess I have one.
It's
I do have
fixable.
one question. So
Sure.
the data between Kings, Harlem, and Queens, which I understand, they're all very similar, got copy and paste the wrong table into the wrong slide perhaps, is what are the square foot, rent per square feet? If you could just let us know what the difference is. Harlem, I mean, are they all the same? Are they all
No, the rents per square feet are accurate here. Queens is 50. I double checked before the meeting and it's supported by the fair market value analysis.
And Harlem is also 50? So
No,
Queens
one
and
is
Harlem-
45. Kings is 45, Harlem's 50, and Queens is 50.
So, right, that's what I meant. Queens and Harlem have the same rent per square foot? That's supported by
Yes,
the comps?
it's based on the comps, correct.
Okay, so the rental comps in both those areas are the same. I'm sort of surprised by that.
According to the analysis
Right.
we received.
Okay. And then I guess this was another just more so strategic question as to whether we've ever thought about doing kind of a base rent for these and then like percentage above it.
You know, that's the
retail?
way we used to do it.
Uh-huh.
And I have to say it was not successful because the hospitals don't really have the wherewithal to audit the take,
I see.
the gross sales. And so we had a minimum rent and then a percentage above that. Never in the history of the organization did we ever get anything above the minimum. So I just thought, let's be more honest about it. Let's try to charge the rent that we expect to get, not put an unrealistic expectation on the fiscal officers of the hospitals who are.
Try to be chasing through. Right, it's a very minor piece of.
They have another focus, and to have them also take on a retail business that they're supposed to be somewhat knowledgeable about and be able to look under the hood to make sure that sales are being reported accurately, not worth the effort.
That makes a lot of sense. Didn't know if the technology maybe had improved to a point where that might be easier, but
Yeah.
I hear you. Thank you.
Thanks. Any questions, Dr. Getz?
No, I agree with the change in methodology based on a difficult case we had.
Okay, then let's take this to a vote then. Dr. Katz,
Yes.
Frida Wang,
Yes.
Jose Pagan, yes, so resolution approved. Thank you so much. Manny, the next three.
Oh, okay. That's a little small for me to read. I'm gonna have to do it this way. Thank you, Menji.
Cannot read from there?
Yeah, that's a little too tough for me. Okay, authorizing New York City Health and Hospitals, the system to further increase the funding by $3,477 and $3,477,599 for its previously executed agreement with Array Architects for architectural/engineering services for the renovation of space in New York City Health and Hospitals Bellevue, New York City Health and Hospitals Woodhall, in connection with the Systems Correctional Health Services Initiative to treat its patients who require higher levels of care for outposted therapeutic housing units, which follows previously funding increases of $1,814,888, authorized in November of 2021, and $6,409,289 in November 2022, and $1,960,238 in May 2023, such that the funding is increased from $18,847,407 to $22,325,006. Second resolution is authorizing New York City Health and Hospitals Corporation for further increase the funding of $2.4 million for its previously executed agreement with ACOM to provide program management services for New York City Health and Hospitals Bellevue and New York City Health and Hospitals Woodhall in connection with the system's Correctional Health Services initiative to treat its patients who require a higher level of care in its outposted therapeutic housing units, which follows previous funding increases of $1,498,738 authorized in May 2023, such that the funding is increased from $16,635,305 to $19,035,305. Authorizing New York, final resolution authorizing New York City Health and Hospitals to further increase funding by $43,022,528 and until April 2025 for his previously executed contract with Consigli Construction Group to serve as construction manager / builder and guaranteed maximum price structure for the construction and the construction management of the system's correctional health services initiative to treat patients who require higher levels of care in outposted therapeutic housing units at New York City Health and Hospitals Bellevue, which follows previous funding increases of $19,421,612 authorized in May 2022 and $19,638,719 authorized in May 2023, such that the current funding increase from $159,969,414 to $202,991,942 to cover construction and construction management at Bellevue only. With that, I'll take a polite deep breath. I would like to hand over the presentation to Oscar Gonzalez, please. Can you take us through it? Oscar?
Thank you very much, Dr. Saez. Good morning. So OTXHU, Outposted Therapeutic Housing Units, we're all familiar with the program, was announced in November 2019. We have previously presented at the board for either enter into contract or increased amounts. And I'll just quickly go through the trips to the board that we've had. In June 2020, we brought the design consultant Array and the program manager ACOM to enter into contract for work related to Bellevue and Woodhall. In November 2021, we brought Array and ACOM back to the board to for acceleration in the schedule and also to enter into contract with Consigli, the builder, the CM builder, to do the physical work. In May 2022, we brought Consigli back to include added scope related to a recreational area, Sallyport, and an exterior elevator at the Bellevue location. And in December 2022, we brought Array back for the design changes that were approved by SCOC, the state regulatory. And in May 2023, we brought Array, ACOM, and Consigli back for increased funding for additional security revisions. Next slide shows you the way that the program is arranged. You have H&H on top. You have ACOM, the program managing, overseeing the entire portfolio. You have Array, who is our design consultant, both for Bellevue and Woodhall. And then you have Consigli doing the physical work for Bellevue only. So we're here to present or request a change specifically for the fields that are in orange. This particular proposed amendment, the justification for it is we have new requirements that involve security operations that resulted in a pause in work or slowdown in work, and we've needed to modify the design and the construction scope. In addition, we had emergency power coverage already included in the base package. However, there was a request for an increase in coverage that involved door controls, lighting, security cameras, and fire safety system, as well as patient spaces, including the intake areas and visitation areas. As it relates to the pause in work or slowdown in work, we need additional general conditions to keep the administrative staff and support staff throughout the completion of the project. We have received the funding already from OMB, and it was incorporated or allocated in our September plan. And the state regulatory SDOC has provided us conditional approval on the work that's going to take place. Just quick disclaimer, this may not necessarily be the final trip to the board, so there may be future engagements for any additional things that might be needed, but we feel that we're at a good place today with the work that's been identified. The proposed amendments, just a quick breakdown, a total of $49 million, specifically for the newly identified security considerations that involve design and construction at $13.5 million. Delays / additional general conditions to complete the work, $9.5 million, and the additional emergency power backup or power generator that's estimated to cost about $26 million. So another breakdown of the proposed amendments, the dollar breakdown proposal for Array increased funding by $3,477,599, and this CP has already been submitted to OMB. The ACOM increase is $2,400,000, and that CP has already been submitted to OMB. It's just awaiting approval. And the consigli funding increase is $43,022,528, and we are also requesting an extended in contract expiration from November 2023 to April of 2025. This CP has already also been submitted to OMB and awaiting approval. There's two parts to this. So the physical space on the second floor is expected to complete around November 2024, where we'll be able to turn over the space, barring any significant unforeseen conditions or any additional design changes that may be requested. And separately, but yet tied to it, is the emergency power generator, which we are looking to complete somewhere around February 2025. However, there are significant global supply chain issues, and if we can overcome those challenges, we may extend it to April of 2025. This slide shows you the WMB utilization plan. Array's utilization plan was 37%. To date, we are up to 31%. ACOM utilization plan was 35%, and they have achieved their percentage. And Consigli's utilization was 31%, and they have overachieved by 40%. That's where they're at today. And next slides are the resolutions.
Any questions? Go ahead.
Hi. Thank you. So thanks for putting all the history together, because I was reading the resolutions. It was very confusing to try to figure out what actually happened here. We've got a lot of starts and stops, and I know this is a great but complicated project. So I guess there were, in my mind, I bucketed into, there was the big regulatory change that sort of changed a lot of things. And that was the first kind of big series of increases to the contract. And then now there seem to be, in May of 23 and now November of 23, additional changes that are coming from where? Like, how is that process? You mentioned required changes for the additional emergency power and things like how is this process working? It seems a little bit different than our normal contractual processes, obviously, with all the regulatory requirements and safety concerns.
So it's and I got my colleagues here from CHS, but it is you have code, and then you have the interpretation of the code. Okay. And we work closely with the states and with the end user to figure out what security enhancements, and specifically here, they need. And this is basically what they come back and tell us, that in order for them to be able to utilize the space, we have to implement it. So basically, it's kind of on the fly. We do the design, we do get the initial approvals. Everything has been approved prior with SDOC. However, the end users have interpreted that they need additional security because we are dealing with incarcerated individuals. So that's how some of the security concerns came up. The generator, the additional backup power, there was basic elements included in the backup power, but they wanted additional backup power in the event that there is a power outage.
They
So,
being like SCOC or,
um,
No, it's the Department of Corrections.
oh, okay.
So essentially, the emergency power meets code currently. This would be exceeding code, and essentially it's because should the hospital lose power, that floor needs to continue to operate as though nothing has happened to maintain security and control of what's happening in the space. Because unless there was a significant event happening, they would not decant that space given the population that's there. So the emergency generator allows for that to happen.
I think as Oscar has said, at the end of the day, they're the end user, Department of Corrections. They say they can't run it without the following things. It's a little hard for us to say, no, we think that you can operate them without the things. There's obviously some interpretation because the SOC had signed off, as had the previous corrections group had signed off on the previous version. But again, at the end of the day, you cannot expect the security people to run what is a therapeutic jail setting at a level of security that they don't feel preserves security. And we're not the security experts. So we cannot say, well, I disagree with you about your security needs. They are the experts. And, you know, we maintain that this would be an excellent program for the detainees. And for that reason, we continue to persist to try to make everybody happy because we want to see them open.
So I think that's, makes sense, the sort of balancing of all of these and the back and forth, and this is new. I mean, we haven't
First
done
one
this.
done.
Right.
No one has ever created one of these, which is again one of the things that leads to the fact that different people can have different opinions about what's necessary in order to maintain appropriate security.
Yes. So I guess a couple of questions then related to that. I mean, I had a question here. This seems like an unusual process, which it is because
It is most certainly an unusual process.
So, and it totally makes sense why it's unusual. And I totally agree that we want to, and thank you for persisting, and we want to see it open. So the question I have now is, now that we have learned a lot over the last few years on the process, I see you have a little caveat here, we may be back. And so are there lessons learned on, you know, making sure we've checked off on the different parties, the end user, the regulatory, the code, all the pieces, as we're making these decisions and deciding on the new contract terms and amounts, and to try to mitigate some of the back and forth? Because my concern here is, I assume, and maybe you can correct me if I'm wrong, that there's been some work that's been done that we have spent a lot of time and money and resources on that maybe we've had to backtrack or change and has been, you know, unfortunately already spent but not usable, let's say. And so is there ways to try to keep that from happening going forward in the things that we've learned?
At Bellevue, we definitely had to undo some work and redo it, and we've been successful. But there are lessons learned, and we're going to incorporate those lessons learned into the other locations that we're going to implement the OTX issue, which is Woodhall and NCB.
And we are working with SCOC on a timetable for check-ins as the work is now in its final phase so that we can mitigate risk of additional work needing to be done. And the same for the Department of Correction. So I do feel confident that we're at the end, but there is the possibility that when they come in to do final review, there may need to be some minor work. But hopefully we have enough that we won't need to come back.
And that's great. And then there's two others, right? The Woodhull and NCB. And those are staggered behind us so that some of this, and are they in a similar kind of, you know, situation or design and requirements that what we have learned from Bellevue can translate to Woodhull and
We can incorporate the changes today into those locations, hoping that we don't have too many changes, but at the end of the day, it's still the interpretation of the end user. But we'll work closely with that end user to try and mitigate as much impact.
But they're technically the same end user, no?
Yes.
Okay, right, yeah.
Yes.
Um,
But they're not the same interpretations.
right, all the time, yeah. Okay.
Yeah.
The other question on, approval. So you note that we have conditional approval. What is that conditioned upon?
There is one piece, it's very minor, but privacy screens that are required for the bathrooms. SEOC needs us to finalize what that will look like and approve it in order for us to move the package forward. And we're in the process of finalizing that now. So there should be,
Nothing, not a big,
no, it's just sort of housekeeping.
okay. And let's see. I think on the point of lessons learned for the other two facilities, I think if you go back to the org chart, Array and ACOM are part of the other,
So the Array and ACOM are contracted for Woodhull,
Woodhull,
but not for
not
NCB.
NCB. Okay. And this contract, the extension, or sorry, there's no extension for Array and ACOM,
No,
but the increase in cost
yes.
will cover, and the term that goes through, I guess, 2025 will cover Woodhull too, or this is just Bellevue?
This one here is just for Bellevue. We've already carved out for Woodhull, and we're gonna continue the conversations to incorporate those lessons learned. And if we need additional funding for Woodhull, we'll have to come back to take another trip to the.
Okay, so the contract that goes to June 25 with Ray and ACOM does not cover Woodhull, or?
There's a base scope that's covered right now for Woodhull, but
So they may need to extend, because this is now going to go, the original intention was Bellevue would be done by now, right?
Correct.
And so if this is going to 2025 now, those contracts may need to be
that's right.
extended for Woodhull as
Yes.
well.
But we're just not ready today to make that request because we just don't know how.
Yeah,
long to extend
not
it to.
appropriate time now.
Yeah.
There could be a lot of changes between now and then still. Well, hopefully, some of what we've learned will prevent this. It's a big increase. I think we've gone from, I didn't do the math, but like, yeah. So, and, obviously the changes we have a GMP, a GMP, obviously is open to renegotiation once we make changes, and given the environment and inflation and all the things happening, that puts a lot of opportunity to put a lot more into the GMP, and so some of that process has been.
Yeah, we'll have to really think about it to see if we do a guaranteed maximum price going forward. We may just do a CM build or even just a traditional.
Right.
The good news is that we know some of the scope elements, right?
Yeah.
We know that there's a requirement for recreational space, for sally ports, for additional security. So at the very least, we can incorporate that and see what kind of an impact we're going to have. But there's still a lot for us to figure out as we roll that project forward, specifically for Woodhull.
So this one, Bellevue will stay under a guaranteed maximum price. So the increases are still considered.
The contract is under GMP, but we've obviously passed the GMP.
Well, right, because usually that allows, if big design changes would allow for an increase in the
Correct.
price.
Correct.
But those contracts.
Yeah, the increases were out of the contractors'
Control.
Control. So.
But there are potential increases that, like delays in general conditions, get factored in. Is that only for the Array, for example?
That is only for Consigli. That is their general condition. So that's their administrative staff, that's their additional insurances, their additional support that they need to manage the project.
But those are delays that were caused by our side
By
as
us.
opposed to them.
Correct.
And so
Yeah,
that's
because
why
the
they were able
project.
to push that through.
Yeah, we were able to keep the project going. We slowed down the project, trying to anticipate some of these approvals to come in, but we were burning a lot of the general conditions. And essentially we ran out of money. So going forward, they won't have the funding to be able to manage the project.
Yeah.
But now with these additional general conditions, it extends us the time, and we should be able to finish the project successfully.
Okay. And the capital costs I see you say have been already incorporated into OMB's budget, so they've been approved in terms of?
Yeah, so our initial estimates were 49 million. They funded it right away. It was landed into our September plan. We prepared all the CP packages, all the backup documentation in order to get that funding authorized. And then we're in the process of doing that now. So I think the Q&A is going to start soon, and hopefully that authorization comes in fairly quickly. As soon as that does, then we'll start negotiating change orders with all the vendors and getting all those purchase orders registered through the controller's office.
Okay. And in terms of our capital budgeting, and I'm not sure if this is, does this, we put forth a proposal each year, I think, for our capital requests for the system, aside from CHS, for example.
Okay.
Does this get included in the systems request? And so if we're scaling up on this project, does that mean the other items that we are looking for get scaled down?
We've been very clear with OMB that we consider this separate from health and hospitals' duties and capital plan.
Okay.
So they've been supportive of that approach so far.
Great.
So we try not to look into.
Okay, so we do try to keep it separate.
Correct.
That's correct. That's what I wanted to hear. All right, thank you. Thank you.
Just a quick question on the power supply or power generator. Because you just don't walk into a store and buy one off the shelf, right? So it's a 26 million investment. So I was thinking about that. But more than anything, like, are there ways in which so it looks like you probably, if global supply matters, that it takes time to design it, and it's just not something that is already built, right?
Correct.
So like, but do you have conversations with the clients so that you end up putting the unit that they require for security purposes, or?
So we mapped all that out already. We've done assessments. We figured out how much additional power they need in order to be able to cover these areas. We are sort of backing our way into a design based on what's available on the market. The global supply chain has been brutal. COVID did not help. A lot of manufacturers laid off a lot of their generator folks. And now, because of all the events that are happening around the world, the fires, the floods, and everything else, there's a huge demand on generators. So a lot of it. What was that?
The specs are clear enough so that you don't expect that they would say, well, you didn't meet the standards, or?
Right. We're backing our way into the specs that will generate, no pun intended, the fastest piece of equipment on site. So,
Remember too, that the biggest disjuncture is that the plans were approved by the previous Department of Corrections, right? So the people are not at all invested, right? They basically came, looked for things that they felt were not right, but that these plans are all with the current Department of Corrections.
So but they must have conveyed to you, okay, we want to work at this level. So I guess it's like, how do you hit that level and above, right?
yeah, I mean, this is all the engineers. They do a lot of calculations. They figure out, like right now, if the power goes out, we know that the exit lights are, stay on. We know that the doors open up. They want it above and beyond. So we make all the calculations, what kind of electrical load they need. If I remember off the top of my head, I think it was 1600 kW of power generation that needs to happen in the event that there is a complete power outage. But then everything's got to get mapped out. How big is the unit? Do we separate out the unit? Where do we install the unit? Do we create dunnage above the ED or somewhere else in the building? So all of that has to get mapped out, along with how fast can we get these units in. So if it's 2 units, there's different lead times than if it's one larger unit. But yes, we have all the calculations. We have the right. We know what the output is going to be. What we don't know as of today is specifically what units will be available to us.
And
we're working on that.
And in addition to that, this is not a typical request. When it comes to emergency systems and generators, they're really there. So if you dropped out power, you have the opportunity to evacuate a space by just the emergency lighting coming on, elevators dropping down, just giving you the basics. But they want the kind of backup power that is essentially no loss of power, like if they had normal power around the clock. So that's a very unusual request, and it takes design and manufacturing a tremendous amount of KW to support it. So that's really where the issue is.
I have a question from Sally. uh, what work has been completed over the last 4 years?
So
Or maybe that's
So
something,
I'll give you a real quick high level. For Bellevue, obviously, the designs have been completed and modified as requested. I want to say we're about, I'm gonna take a wild guess here, we're about 75% complete with the interior space of the second floor at Bellevue. We still got another roughly 25% to complete, and that completion is, redoing some of the work that was previously approved. The generator itself, we're just designing it now. So I'm hoping that in the next few weeks, few months, we can complete the design criteria as well as design specifications to start releasing some the orders to the manufacturers. That way we can tell them, okay, this is what we're going to go with. Design is to start manufacturing it while we release other packages to Consigli to be able to complete that work.
and nothing on Woodhull then?
Woodhull, the designs are pretty well baked. We did not proceed with the construction. And the designs at NCB are at schematic level.
The Woodhull is not using a GMP structure, you're using a different?
I'm not sure yet.
Okay.
The original plan, it was to use the GMP under different circumstances, but I'm thinking we might go a different approach. We'll see. We'll approach that bridge when we get there.
And just to add on Woodhull, we did finish decanting the floors that
Oh,
the outpost
yeah,
is going
right.
to be, and we opened, when we talked with the new units we opened.
Thank you,
Yeah.
Carrie. I forgot about that small little project. So that's
No, it's
I think that was $30-40 million of decanting in the 9th and 10th floor. So,
Oh.
yeah.
Yeah.
But the spaces are beautiful. You know, if you guys ever want to go take a visit, the work came out really, really nice. So the 9th and 10th floors are ready to be built on.
Thanks.
Thank you.
Okay, so let's take it for a vote. Dr. Katz?
Yes.
Frida? Fine?
Yes.
So Pagan, yes. Thank you so much. So resolution approved. Thank you.
Thank you.
Is there any old or new business to come before the committee? Hearing none, meeting's adjourned. Thank you so much.
This meeting is no longer being recorded.